welcome to today's session called Death Grip of Nicotine Addiction and Teen Vaping. This is the SB Connect Industry Series where we connect to and educate for the world of work. Today we have Dr. Neeki, Chief Medical Officer from the Arrowhead Regional Medical Center, who is going to be talking to us about the impact of nicotine addiction and teen vaping on teen health. And so please keep all of your questions towards the end of the presentation where we will have a Q&A. Okay, I'm going to go ahead and hand it over to Dr.
Good morning. Good morning. I'm excited to be here, and it's wonderful to see all your individuals that are future of our countries and communities. If you're okay, I'm gonna start this lecture, and then at the end we can have a discussion about any question that may come up for you guys. This is not by far all-inclusive. It's just giving you a little bit of a window of opportunity to know what's going on around here. So our focus today is on the vaping part and how it's being manipulated in the industry to get our young people addicted to these products. So what is e-cigarette? E-cigarette or vaping products, if you hear about it, it could come as a electronic cigarette itself. You see it just, it has a battery unit on itself. And it has different names. It looks like a pen. It looks like absolutely like a regular cigarette that they're holding, but it just, you know, has a little steam that is coming out of it. It could be e-cigarette, which also heating a liquid aerosol that is inside, but then takes that into the lung without filtration. And then there is also a liquid component, and you see those are usually bigger unit, larger unit you see in the hands of people walking around. And in those cases, they can actually put in marijuana extract or different flavors and products that contains either nicotine or illicit drugs, at least for your age group. So why is it important? Before COVID and 2019 COVID, this was probably one of the worst experiences we have had in medical industry in terms of lung injuries. Okay, it would really, when the juvenile were using or young individuals were using this products, they were really killing themselves by killing their lungs. They could not breathe, and it would be a scar formation. And this is an example of one of the cases where the patient pretty much died at age 15 using this product from the complication of it. This is a basically CDC report just to tell you how many deaths that can be contributed. This was 2019, but most of this data is from 2018 year. So they had 2,500 cases of mysterious lung problem or disease that they would go to the hospital that would last over 8 months. And 55 of those cases were, they died. So in reality, the number of cases of death from vaping complication and nicotine complications were higher than the actually COVID that we have right now in a percentage, if you divide 2,500 by 55. So one of the major problem is that this vaping markedly affected young people, which came in presented with the chest pain and shortness of breath, vomiting, and 15% of these e-cigarette involved cases were less than 18 years old, which is pretty much you guys, your age group. And if you look at the basically number of hospitalization of cases with death in 2019 prior to COVID era, and if you look at the map, California, it's roughly around 100 to 149 to 150 area of cases reported, and one of the worst cases were in Indiana and also in Texas, if you see it on the map with the dark colors. So the key fact about the products are this. Out of the 500,000 people who became a smoker because they had tried vaping as 2018, an estimated of 170,000 of them, so it's almost like 1/3, will be dying prematurely due to smoke-related injuries. So what happens with the smoking? It could be a pleasure right now, but in about 10 to 20 years, you will start having a lung problem. It's called chronic obstructive pulmonary disease, COPD. You will need inhaler, you will be short of breath in your activities. And many of you may have seen family members, relatives that are complicated with these issues. The graph that you see on the right side, it shows a high school student smoking less because our advertisement and education regarding smoking had worked. But then right there, somewhere around between 2013 and 2014, it flipped and increased vaping. And you see it because it became more glamorized, packaging nicely, tasting in different things. But do you really think that you can eat, for example, air fresheners in your car that you're hanging in the window in your parents' car, your car? Or for those of you who drive, they are toxic material. They're made from toxic, but it's a chemical combination that smells a particular flavor or tastes particular flavor, but they're not really a normal product of nature. They're not natural products. So as a result, all those chemicals are going to go into the body and create that reaction that we're talking about. In the left side, you see a lot of those nice, colorful packaging and melon twist and lemon twist, are all tasty, you know, for those who like lemon or so this is how they're going to attract you to this. So what are some of these products? What's the fact about vitamin E acetate, which is vitamin E acetate is one of the products that they are using in the vaping. And in fact, the University of Riverside is one of the probably most advanced places where they have studied with a grant from federal government to look at the complication of vaping and look at the chemical structures that have been imported. It used as additive, most likely in the THC containing cigarettes or vaping products. So marijuana extract that they put in, they put this vitamin E actually is in many food. They are okay to go through a dietary supplement to your stomach or using it as a skin cream, but they're not good when they go into the lung. That's a totally different physiology. And that's where it causes allergic reaction and causes interference with the physiology of the lung. So here, I'm showing you on the left side, basically anatomy, nasal anatomy all the way to the lung. So when you vape or smoke or anybody does that, it goes through pharynx, mouth to pharynx or nasal cavity in the exhalation period, goes to the larynx where it splits the esophagus and trachea. Then it goes through trachea. It goes to the larger pathway of the lung, which is bronchi, and then to go to smaller particles of the lung, which is bronchioles, and all the way to where the air exchange will happen, which is basically alveoli, which is you see on the right side at the bottom, with those small little cute round balls that you see there. That's where the oxygen and CO2 exchange happens during the pathway of ventilation and oxygenation. And then on the pictures on the top, you see cilia, which is basically layers of sort of like an escalator layers that are inside the lung. And that's where when you cough, you get rid of foreign object that enters, like dust and bacteria and viruses. So coughing is a reaction of the body to get rid of that foreign body through using those cilia. But when you smoke and you use chemical like vitamin E content, it kills that cilia. And as a result, if you look at people who are long-term smokers, when they are coughing, they can't bring anything up. They're persistently coughing because they want to get rid of the stuff, but they can't. Their escalator or their mechanism of getting rid of the foreign body has been diminished or destroyed by the smoking pathway. So what happens during the respiration? In the respiration, you basically take the air in, which whatever contains, it goes all the way, as I was showing you, those small little cute balls in different colors. You see it on the left side, capillaries. And capillaries are around the alveoli sac, and alveoli is where the oxygen and the CO2 is being exchanged, and that is basically respiration and ventilation in the normal pathway of the breathing. Here we're looking at a pathway, a normal pathway of the lung again, the right and the left, and all the details that we talked about. Basically, diaphragm is a mechanism that helps us breathe by dropping and creating a negative pressure so the air can enter. But on the right side, I put two pathological pictures. The two pictures are real lungs from somebody who was healthy and passed away, and somebody who was a smoker and or used the inhalant, just like what we were talking about. So look how dark it is, because lung acts like a filter. So some of you may be actually good in mechanical things, you know, changing filter, air filter on the car or oil filter. If you're changing an air filter on the car, when you're putting a brand new, how clean and smooth and white it looks like, and when you're taking the old one out, it's dark like this one. That's because lung in our body is like a filter. It needs to take the air in, filter all the foreign bodies and objects, and then get in. So if you have chemicals or nicotines or components that are in the cigarettes or those products, what it does is basically gets filtered and catch up with this. And that's what it forms, that dark gray black color. And people cannot breathe, obviously, because their filter is basically clogged up in a simple language format. This is basically other injuries. So that was the main injury that kills a lot of people. But then at the same time, we also noticed product issues that are coming out. And one of those is basically explosion that is happening with the vaping products. The battery, it's right in the back, and in the front of the battery is a containers where they put the materials inside. Once the material leaks in the shaking or falling on the ground or something happened to that, that shaking causes that liquid to leak out, go toward the lithium battery that is located in the back, and then a sudden explosions happens. So you see right now a burn on the right side that is caused by somebody's e-cigarette being in their pocket. And basically once she was moving, it got explode. On the left side is a physician that is showing basically a pulmonary injuries and clot that is caused by the vaping injuries and explaining about that. This is actually a case that I had and is actually published. So that's why I can show you these pictures with the permission of the patient. This gentleman was smoking. As you see the smokes on his lips, the cigarette exploded in his face. And the sheer pressure, the kinetic energy that was released by that e-cigarette went through his nose and causes a breakage on the skull at the back of his nose. So the air leaked into his brain. And that's what you're seeing on the right side. On the right side, you're seeing air in the skull. And that's where basically he got a leakage along with the bacteria and air. So this gentleman is, and obviously we've repaired his face. The two plastic that you see, because he had a nosebleed, we had to put a nose plugs in to prevent that bleeding or stop that bleeding. But at the same time, he got surgery and he got long-time antibiotic therapy as a result of one complication from smoking. And he was lucky that he didn't die. But usually, you know, you can die from the amount of air and bacteria that enters into your brain from that kind of explosion, or become blind. So what is strategies would work for your success? You know, how do you basically deal with temptations and products that are being marketed and it looks cool. Your friends are they're trying to encourage you to use it. Listen, I've been in high school too. At some point, I was in your age, and I had people who were drinking, using drugs, and using illicit materials, and they were trying to get me into that too. So set a good example for yourself. Set a clear goal of what you're gonna do, what you're gonna be. Even and I know some of you have uncles, brothers, family members that maybe are actually gone through this pathway, and so you got a practical experience. The main thing is to avoid it. So understand what is in the market. How are they trying to lure you into it? Be able to say no. That's very important. Your decision always is, I'm going to have this cool cigarette. Why don't you come with me? Well, no, I can't. I'm sorry, man. I'm a good friend with you, but that's not the one that is good for my body. Think beyond cigarettes. Think what the complications are. You may enjoy it right now, but what's going to happen down the road to you and your health? It's basically a way that they are trying to attract you to it. So do the math, look at the future, look at the your own perspective in life and what you're going to do, how useful you're going to be to you, yourself, your family, and how proud they're going to be to you. Expect peer pressure. That is not natural. Your classmates, your school, that's one thing that we know that is going on in the school. A encouragement by peer pressure to get you hooked on these things. Take the addiction seriously. It destroys your life. It destroys not only your future, but in terms of job and prosperity, but also your health at the same time. We deal with it every day. We see teenagers coming in with complications from these issues. What we're trying to tell you is the reality that it is. I don't usually try to scare people. There is nothing to be scared about, but it's your future, it's your decision, and how you're gonna, look at yourself in the future. Consider your positions, what do you want to be in the military, you want to be a doctor, you want to be an engineer, you want to be a lawyer, you want to do something for your community, then you better keep yourself healthy. You're an asset to our community. That's what we like to say. Some of you guys are going to be physicians who are in the future are going to treat me when I'm getting older. So that's where you want to be, where your hope is going to be. And then get involved in maybe a committee with your school administrators in asking for banners, asking for pamphlets. There are plenty of educational programs, either from CDC, Public Health Department, your local schools, school administrators that are free for you to educate yourself regarding these issues. So it's very important to go there. So how did we get here? I just want to make sure that you understand also that I totally get it, that you are also in disadvantage looking at all this advertisement that is coming through media and social media, specifically. In your era, social media is one of the most toxic. The guy who was advertising for Marlboro, he's sorry that he actually died from a lung cancer. That's his picture up there. In 1960s, he was basically 1960s and 70s, he was the cool guy, the cowboy, smoker. You're looking at the picture of hookah. Hookah is not any better than smoking or e-cigarette or vaping, not any better. In fact, I joke around that if you feel that nicotine is not getting toxic enough, mix it with the water and let's make it more vape and go through it. So it may look cool, but all of those guys have problem at the end of the year. They all develop lung disease and lung cancers, and they do a miserable time in death. So the key, again, I'm going to repeat that. The key is to look at yourself, knowing that you have the knowledge, that your teachers have educated you, your community have done this. Today, you listen to me and I gave you the 2 cents from the end of the point where I take care of the patients at the end of their life when they have complications to prevent yourself from getting into this mess. And also being useful to your friends and family members who are maybe smoking and stuff, to encourage them, to support them. Not getting into the vaping and smoking is one part. Support is very important. So you could actually be very effective also by taking this knowledge to your parents, to your grandparents, to your aunts and uncle and family members, and encourage them not to smoke and slowly quit that over time. There are other options for them, and they can talk to the physicians, such as nicotine delivery patches and different things, but those are for people who are addicted to that nicotine stimulant on a daily basis. I know it was a short presentation, but I want to acknowledge the San Bernardino School Superintendent, Arrowhead Regional Medical Center. I'm also involved as the Chief Medical Officer for Department of Probation. So I take care of a lot of the youth on the other part of their troubles, and I'm hoping that they change their life when they come back. And then also California Youth Opioid Response was one of the programs that I'm dearly involved with to deal with other addictions in the community. At this point, I'm gonna stop here and ask you if you guys have any questions, so we can have discussion regarding your questions and concerns about the vaping.
So if you would put your questions in the chat box, we'll go ahead and present those questions or concerns to Dr. Neeki now. While you're getting your questions ready, Dr. Neeki, I know some of our students or our community may be suffering from addiction directly or indirectly. What kind of resources are out there for students in this situation?
So addiction education, our Department of Behavioral Health and also our county public health has resources that you could tap in. They're actually, and frankly, a lot of my resources are coming directly from CDC website or California Department of Public Health, which actually has a direct connection to CDC, and a lot of funding comes through them. In fact, I know that superintendent of the school has a program about the nicotine addiction, and there's a team that is being assembled together for educational program regarding nicotine. And they are funded by the grants that are coming from the state and federal government. So that's part that usually we are really poor in communication, unfortunately, in this great country. One thing that I would love to is tapping into these resources that already exist and connect them to the school and the administrators in the school, the educator in the school, so they can utilize this part. As far as educational program regarding pathophysiologies and knowledges on the higher level, they could always communicate through you with me, and I will give them other resources and physicians and doctors that are available to participate in educational program.
Thank you. We have our second question. So a student says, why does it matter to you all that we smoke tobacco and use vape pens? It's legal, right? Can you answer that student's question?
So there are a lot of things that could be legal, but legal doesn't mean that is good for you. Okay, like having a hamburger every day, you're gonna put yourself at the risk of heart attack at age 30. Okay, it clogs up all your arteries, or not working out. So it's legal term comes from constitutional right. Okay, so it is legal, it's constitutional. Right now, for example, use of marijuana over age of 21 is legal in the state of California, but doesn't mean that you have to go and use marijuana. It doesn't make sense when I tell you all these side effects and issues related to the health is coming from it. I would much rather that you guys go and take multivitamins like B vitamins and make yourself healthier, eat better, and keep yourself healthy rather than looking into what is legal, so how can I use it? Tobacco is not obviously legal for your age group, obviously not. So if you having access to tobacco, alcohol, or THC in your age group, it's illegal, it's illicit at this point.
And Dr. Neeki, can you speak to some of the impacts to society that are due to some of the addiction and use or even legal use of these substances?
Yes. So what happens to someone that, for example, smokes for 20 years and have early cases of asthma and COPD, the chronic obstructive pulmonary disease that we talked about? They're going to need inhalers every day. Those inhalers are about $200 a week right now at the cost for that patient. And then down the road, they will not be able to have activities, they cannot work and contribute to the community, and they're going to start suffer medical conditions that also, as a result, takes their family through the same road. If my father or your relatives get sick, you're going to feel that trauma too. It's going to affect indirectly your family too, whether it's the income that is not coming here on the top of the emotional issues that you have to carry on. And early death, that's one of the things that we always, so what we trying to tell you or transfer this information is that you guys are assets to our community. You need to be strong, you need to be educated, you need to be productive for this community to carry on. If we lose you in an early age, we're not going to have somebody to work for this country or be effective in our communities. You're going to be the future leaders. And that's what we want to, we want our leaders to be healthy leaders so they can think right, act right, and protect our communities.
We have another question. Does flavored blunt wraps hurt smokers as much as tobacco? Is it less hurtful to smoke marijuana rather than tobacco?
Okay, so there is two components to it. In a smoking, you're only getting nicotine, okay? You're not getting flavor like the regular cigarette. Maybe some of them has like menthol or things like that in it. So that nicotine is addictive. In other words, it will increase your, if you smoke for about a week or so and you stay away from it, your heart rate is gonna go up, you're gonna get agitated. So those are addictive sort of sign. You can have nausea, mild headache. On the other hand, you're talking about THC. So it's not really compatible. So marijuana has not only a euphoric substance in it, but also it has addictive substance in it too. So they are two different things. We cannot confuse all the products together. One thing you have to make it clear is that all of them are harmful, one way or the other. They either have nicotine in it, or they have chemical like vitamin E that I talked to you that destroys your lung on the top of your nicotine intake. And then we also see a boatload of complications from those who smoke marijuana right now, which is basically it affecting their brain to having a intractable nausea and vomiting on a daily basis, which is not a normal trend. Like 30 years ago, marijuana used to come from the farms. Now they are mixing it, they're making it more potent, they're adding synthetic issues to that. Your educators remember about 10 years ago, we had a major problem with bath salt. That was a product of toxins and materials that were under legal issues, selling under cents, and people were loading into the blunt cigarettes and things like that and behaving bizarre, affecting the chemical. So when you use cigarette, that's addictive. When you're using a drug, that affects your long-term psychological behavior, okay? I can tell you, I can assure you that about 60 to 70%, if not more, our psychological problem in this country as a result of drug use. It changes the mapping and demand of chemicals in the brain, changes over time as you use these chemicals. So no, nothing is good, in my opinion. Okay, a lot of people have difficulty asking like, hey, have you ever used a drug? No. I poked on cigarettes when I was young, yes, but that was it. I walked away and I said, it's not for me. I'm an athlete. I want to stay healthy. It's different. As you go through your ages, your education, you realize that you don't get pleasure from it. Your pleasure changes. Your direction in life changes. So at this point, you guys have to keep yourself in line and safe. And as you go forward, your priorities changes in life. You will have loved ones, you will have family that you have to take care of. So.
Okay, we have another question, Dr. Neeki. It's about vitamin E. Vitamin E, if vitamin E is hurtful to our lungs, why does the government allow people to sell it to the community?
They are selling it to take, you do need a vitamin E in the function of your normal body, okay? Multivitamins and vitamins are good for the normal function of cell and metabolism in your body, physiology of the body. But you take it by mouth, or if you come to the hospital, we give you through intravenous. If you take an oil and put it in your lung, it's gonna clog up those alveoli. So it's a toxic way of taking it. That's why we're trying to tell you that vitamin E that is in an e-cigarette or vaping products is hazard. But vitamin E that is on the shelf in the Sam's Club or CVS, it's okay to take by mouth because we already did a lot of research on that. We know where it's going, okay? Vitamin E, by the way, there are 4 vitamins that are oil-based, not water-based, okay? And those 4 vitamins that you have to remember is vitamin A, vitamin E, vitamin D. Let me see. And those are the ones that basically get stored in your liver as an oil base. So when it's an oil base, it's toxic to the lung to take it and inhale it.
And Dr. Neeki, does the vitamin E give off a pleasure? Does it heighten the senses?
No, they are using it as an accelerant or carrier. Okay, in order for a product or chemical to be stable enough to go from that compound of heat into your lung and sit down there, it has to have a carrier in it. And that carrier is basically vitamin E. And then also it may be a component of the chemical that they make for flavoring.